This project is Health Through Early Awareness and Learning, or HEAL. Project HEAL, or Health Through Early Awareness and Learning, is a 5-year, community-based project funded by the American Cancer Society. The goal of the project is to increase breast, prostate, and colorectal cancer screening among African American women and men age 18 and older working through faith-based settings. Project HEAL uses relevant spiritual or religious themes and scripture to encourage people to think about getting tested for cancer early. What is spiritually based health education? It is when health education is conducted within a church setting. It is also when the health education uses existing spiritual themes and selected scripture to support the health message. It may also include more general cultural themes. The spiritual content in this type of health education is identified by community members to make sure it's relevant to the congregation. The HEAL Project materials and approach have already been used in faith-based settings and found to be effective for increasing cancer knowledge and screening. We are now ready to share Project HEAL with more churches. We will do this by working with 14 African American churches in Baltimore City, Baltimore County, and Prince George's County, Maryland. Each church will hold a series of 3 workshops led by trained community health advisors, or CHAs. CHAs are people from the church who are natural leaders and trusted in the community. The CHAs will teach about early detection for breast, prostate, and colorectal cancers. The CHAs will also help workshop participants with any issues they might be facing that may prevent them from getting checked for cancer. Volunteers have been used worldwide to promote health. Community health advisors, or CHAs, are natural helpers, volunteers, educators, and advocates for healthy lifestyles. There are many names that have been used to identify community health advisors, such as volunteer worker, community health outreach worker, lay health advisor, and health promotion outreach worker. CHAs are people that are naturally willing to help, that others go to often for help or advice, who seek improvement of individual and community health, and who bridge the gap between health services and local communities. The roles of the community health advisor are to learn about breast, prostate, and colorectal cancer, as well as early detection, complete the community health advisor training, and become certified as Project HEAL Community Health Advisors. CHAs in this project will provide educational information about breast, prostate, and colorectal cancer to members of his or her church. The church members will learn the information through a 3-part workshop series and printed educational booklets. The CHAs will also encourage church members to talk to a doctor about getting checked for cancer. CHAs are not meant to take the place of a healthcare professional. CHAs encourage their members to have regular contact with their healthcare provider. CHAs also encourage others to take advantage of local health services. They act as a liaison between people in the community and healthcare providers to make sure people are educated about how to stay in good health. The goal of the community health advisor is to get the facts on breast, prostate, and colorectal cancer, learn those facts, and lastly, act on the facts.